What is NHS Continuing Healthcare, CHC? NHS Continuing Healthcare, CHC, is a care package arranged and funded by the NHS. The assessment can be complex, but if you qualify, it can make a real difference to your care and quality of life. Understanding how CHC works and who qualifies can make the process smoother. To qualify for CHC, you must have a primary health need. This usually means your needs cannot be met by adult social care services. You may get CHC if your needs are complex and urgent. You need ongoing care at night and in the day. Your condition is changing quickly and managing your care is difficult. CHC covers health needs and social care needs. You do not have to pay for CHC. CHC funding is available in England. Many of the rules in England apply in Wales. If you live in Wales, contact Health in Wales for more information. In Northern Ireland and Scotland, CHC is not available. However, a similar package of care may be offered. In Northern Ireland, contact your local health and social care trust for advice. In Scotland, contact Care Information Scotland. A CHC application is done in 2 stages. The first stage is a checklist completed by a health or social care professional. This will decide if the full assessment, the second stage, is needed. It can help if the professional knows you well and has experience of MND. Ask a member of your team to complete a checklist if this has not been offered and you think you may qualify for CHC. You can have an advocate, family member, or someone involved in your care with you when the checklist is completed. Visit www.gov.uk and search for Continuing Healthcare Checklist to download a copy and see what it includes. The checklist groups your needs using 11 headings, known as domains. They are breathing, nutrition, continence using the toilet, skin, mobility, communication, psychological and emotional needs, cognition, how you think, behavior, drug therapies and medication, altered state of consciousness, such as seizures. Your needs will be scored in each domain as either low, moderate, or high. If you get an overall high score, you will need the full assessment. The full assessment is a detailed review of your health and social care needs using the Decision Support Tool, DST. This should be done by professionals involved in your care who know you well. If this is not the case, ask the assessor to contact your preferred professionals to get detailed information about your needs. Your views should also be recorded. It may be helpful to have a family member or friend with you. If you wish, their views should be taken into account. Assessment is not based on your diagnosis. It will focus on the nature, intensity, complexity, and unpredictability of your needs. The assessment follows the same domains as the checklist, plus another for any other significant needs. Visit www.gov.uk and search for Decision Support Tool to download a copy and see what it includes. Give lots of detail to get the level of support you need. For example, if you say, "I have difficulty swallowing," they may not fully understand the problem. Give more detail, such as, "I find swallowing difficult. Sometimes food goes down the wrong way and I cannot cough to clear it. This is leading to repeated chest infections." Explain what you need on your worst days, not on your good days. Any needs not captured by the domains in the checklist are written in any other significant needs. With MND, this may include saliva management, fatigue, emotional lability, where your emotional responses do not match how you feel. Your needs in each domain are scored from no needs up to priority needs. You should qualify for CHC if you score priority level need in the breathing, behavior, drugs and medications or altered state of consciousness domains, or severe in 2 domains. Other combinations of scores may also qualify. If you score mostly no needs or low needs, you would be unlikely to receive CHC. At the end of the assessment, the health professionals will make a recommendation about whether you should get CHC. If your condition is getting worse quickly, or your health professionals feel you may be reaching the end of your life, they may complete the Fast Track Pathway tool. This will be completed by a doctor or nurse, and you should be accepted for CHC funding usually within 48 hours. Fast Track funding is regularly reviewed. If your CHC application is approved, you will be supported to discuss your preferences and plan your care. If you were getting support from adult social care services before, this will now be managed as part of your CHC. You may need to change to a new care provider to get the level of care you need. If your application is refused, you should receive a letter explaining why. You can make an appeal and send any evidence you feel was missed. If your appeal is unsuccessful, you can ask for an independent panel review. This must be done within 6 months. This may feel difficult, but if you and your health professionals agree you should get CHC, it is worth it as many reviews are successful. Useful resources. The MND Association provides Information Sheet 10D, NHS Continuing Healthcare, with more about the process and links to help you find further information and support. For health and social care professionals, Information Sheet P7, NHS Continuing Healthcare for MND, covers each domain in the CHC assessment and how MND may fit within these. Find our publications at www.mndassociation.org/publications or order copies from our MND Connect helpline. Call 0808 802 6262 or email mndconnect@mndassociation.org. Our helpline can also offer support with all aspects of MND, including accessing CHC, appeals and signposting to other support.